We're talking leadership with a leader who's been dealing with a whole range of difficult challenges. We'll continue to every day. He's Brian Gragnolati, President and CEO of Atlantic Health System. Brian, good to talk with you.
Thank you.
Brian, as a student of leadership, I know you are as well. How has COVID-19, the reality of it, we're actually taping this in mid-June, how has it in any way altered, changed, impacted your view and approach to leadership?
Yeah. I am so proud to work with the 17,000 people here at Atlantic, because what I saw was a level of engagement, a level of resiliency, and an absolute focus on caring for our communities in ways that I would have only dreamt of. I knew we were good. I didn't realize we were that good. And I go back and think about, well, why is that the case? Why were we able to respond the way we responded? And I think it really comes back to staying focused on three important things. One is, how do our decisions affect our patients? And I saw examples over and over again where that was the centerpiece of everything we did. I was rounding at Morristown Medical Center the other day, and I was in the ICUs, and that ICU is now no longer has COVID patients in it.
Right. But as we're doing this program right now in the middle of June, we hope it stays that way. Go ahead.
But the nursing team were telling me about all the innovations that they did in partnership with their colleagues in engineering, partnership with biomedical engineers, respiratory therapy services, and they completely reconstructed the teams that were providing care. Because when you quadruple your ICU capacity, you don't have enough intensivists, you don't have enough critical care nurses. And so team members from all over our organization stepped up to take on different roles and ended up working under the direction of a skilled clinician like an intensivist, and you had cardiologists who were providing care, and you had other types of physicians who maybe didn't have that kind of training, but they were taking that guidance, and the same thing occurred on the nursing side. So the second thing that we stay focused on here is, how do we care for our team members? And one of the most gratifying things that I have heard from so many of our team members is that they felt that we did everything we could to protect them. Because this is a scary virus. It's a scary virus, and you can't compartmentalize it because it affects you whether you're in your community or at work. And we did everything to make sure that we had the right protective equipment, that we had the right number of team members. We didn't lay anybody off. We did not furlough anybody. No. And we made a conscious decision to do that because we felt that this was going to be an all-Atlantic effort. A funny story on that is, we are the sponsors of the Jets, and we do a lot of the work.
The New York Football Jets.
Yes.
They have a practice facility up there, right?
Yes, they do. And so we provide a lot of services for them. But a couple of our trainers, when we went through the forced shutdown of different types of care to create capacity, a couple of our trainers decided that they would become environmental services workers and be part of the team that would move with the patients who had COVID to the areas that they needed to go to for their diagnostic tests or their procedures. And they scrubbed every place down where those patients and team members went, the elevators, the hallways, and they did that for weeks, and they became part of that care team. So you ask yourself, you couldn't have put that in a plan book, right? How do you get people to mobilize around that? And it's just creating this sense of purpose that it's about our patients and it's about each other. And the other thing that we focus on here at Atlantic then are the resources. But what we said is, we will deal with the resources later. we have to figure this issue out. Now, fortunately, we've been able to work through some of the government programs, and we appreciate the support that we're getting. We need more, but we appreciate that support. So I think that we've just had an amazing output here, and I'm just very, very proud of our team.
Brian, one other quick follow-up question on leadership. I've asked virtually every leader we've interviewed for this series about how they deal with their own fear and anxiety and insecurities and uncertainty and all that, and the importance of, quote, not letting your team see that no matter what you're feeling. And as a leader of a small not-for-profit, as well as a leadership development company, you're sitting there going, who owes us what? Are they going to pay? How can they pay if they're laying people off or dealing with all kinds of issues? Are we going to get new clients, sponsors, whatever? So I'm dealing in the middle of the night doing math on a budget and saying, why do we have to lay off more people? What do we do? But I don't want our people to see that I'm anxious. How do you hide that? Or do you not experience it like the rest of us?
I struggle, like we all do, with balancing that. So your commentary is exactly kind of the normal human condition that we all experience. But one of the things that I have tried to do in my entire career is stay based on the principles. And I have a plaque in my office that was given to me by the leadership team after my first CEO position when I was moving to another organization. It was called Gragnolati's Golden Rules.
Gragnolati's Golden Rules. Go ahead.
Right. And it was 3 questions that I asked always about any complicated issue. How does it affect our patients? How does it affect our team members? And how does it affect our numbers? And it's in that order.
Numbers third.
Numbers are third.
Not first.
Not first.
Because?
If you do the first 2 right, the last one's going to work. And that has been my experience my entire career. And it didn't change in this effort. Now, some would argue that that's blindly naive. So far, it hasn't been. It's worked because unless you have a purpose and unless you are a leader that has your team members' backs and try to stay focused on that, you can make a lot of money, but the minute something bad happens, everybody's going to go out the door. And I found that to create this culture of caring, you got to stay focused on that. That's probably why I'm not in private equity and I'm probably not an investment banker. So.
Well said. Brian Gragnolati, President and CEO of Atlantic Health System. Thanks so much, Brian. All the best.
Thank you.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Johnson & Johnson, MD Advantage Insurance Company, Horizon Blue Cross Blue Shield of New Jersey, the New Jersey Economic Development Authority, the New Jersey Education Association, the Port Authority of New York and New Jersey, Summit City MD, Valley Bank, and by the Adler Aphasia Center. Promotional support provided by the New Jersey Business and Industry Association and by Insider NJ.
In the fabric of America, they are the toughest threads. One of the first things they learned was the code that every service member lives by: leave no one behind. Now all of us need to live by it too, because some veterans are being left behind. 20 of them take their own lives every day. Learn how to be there for a veteran at BeThereForVeterans.com. Honor the code. Be there. Leave no one behind.